If Black patients are diagnosed later in disease, it can affect their treatment plan for a couple of different reasons. One is if there is a significant amount of disease that we see in the brain and especially in the spinal cord, we may have to treat the disease more aggressively, meaning using some of our very efficacious or very effective treatments to try to slow the progression of disease. I think that also it's important to recognize that the later someone is diagnosed, the more chance they have to accumulate disability. So sometimes it's not necessarily a fact that someone is diagnosed later, but they may be diagnosed and decide not to go on treatment. And sometimes we can run into quite a bit of trouble with that because once someone develops a disability, again, we cannot fix what's already broken. So if we catch the disease as early as possible, and especially if someone looks normal physically, we hopefully can try to keep them that way. So we want people to be diagnosed as early as possible, to start treatment as early as possible, to prevent disability in the long term. I often tell my patients that we're not just worried about how you look right now, we're worried about how you're going to look 10 years from now, 20 years from now, because MS is a lifelong disease. People usually do not die of complications of MS. They have pretty much a normal lifespan. It just is a matter of how disabled or how much disability we accumulate during that lifespan. And that makes a difference in a person's quality of life.